I'm joined today by Mark Rosenberg, who's the founding director of CDC's National Center for Injury Prevention and Control and a retired assistant surgeon general. Mark, it's so great to talk to you. You know, we've started to hear more of this discussion, this claim that the CDC is hampered or prevented from studying gun violence as a public health issue by Congress. And that's sort of the basic assertion that is made. And oftentimes people don't actually know what it is that's being referred to. So let's start there. What are the restrictions that exist for studying gun violence as a public health issue?
Well, I think first it's very important to understand there is no ban on federal funding of gun violence research. No ban at all. And the way that Congress affected CDC's study of this important issue was by firing some shots across the bow. In 1996, they fired the first shot across the bow because they took away the money that CDC was using to fund its studies of gun violence prevention. And this was $2.6 million. They took that out of the Injury Center's budget for gun violence research, and they said it had to be used for traumatic brain injury. So that was one shot across the bow. The second was what's called the Dickey Amendment now, and they put language into CDC's appropriation that said none of the funds appropriated to the Injury Center shall be used to promote or advocate gun control. Now, CDC was not in the business of lobbying for gun control legislation. They weren't in the business of doing research. So this didn't prohibit the research, it really prohibited their lobbying. There was no real problem with that. But what it said to people at CDC and in the federal government was that if you do research in this area, we're going to watch you closely and we will hassle you. We will have congressmen write letters to the Secretary of HHS and say that you're promoting gun control legislation. And CDC bureaucrats thought, even if we're not doing that, we don't want to spend all our time answering these congressional inquiries. So these things, taking away the money and putting in this money, this language prohibiting the promotion or advocacy of gun control, kind of warned the community of researchers, this is going to be a very tough area to do research in. So a lot of people on the outside thought, I'm not going to commit my career to an area where there's no research funding forthcoming. And a lot of people on the inside, bureaucrats at higher levels, thought, I don't need another hot potato where we're going to get dinged by Congress all the time. So at first, the director of CDC, David Satcher, understood how important this research was, and he found ways to keep it going. He had our back. But subsequently, a new director came in when David Satcher was called to Washington to become the Surgeon General. And this new director thought it was more important to protect his own career than to protect the science at CDC. And he fired the director of the Injury Center, the person who was most closely connected to wanting to establish gun violence prevention research. And this was the third shot across the bow. It's important to understand that this third shot, and maybe the loudest shot, was not fired by Congress. It was fired by the director of CDC.
So, Mark, is it fair to say, and I want to sort of, when we, it's so important when we talk about gun violence and research into it to be as accurate and precise as possible. The talking point that the CDC isn't allowed to research gun violence as a public health issue is actually not true. Would it be more accurate to say it's been made clear that the CDC will be hassled if they choose to research gun violence as a public health issue? And in addition to that, that new CDC leadership itself has sort of made it clear that they're opting not to get involved in that research. Would that be a more fair way to sum it up?
I think that would be very accurate. In fact, the president, after the Newtown massacre, told CDC, get back into this business of doing gun violence prevention research. It's critical to our nation's well-being. And he issued an executive order telling CDC to do that, and CDC has not done that.
So can you explain to our audience, when we hear that phrase, research gun violence as a public health issue, what does that mean? In other words, research it as a public health issue instead of as what, and why is that important?
When CDC says we're going to approach this as a public health issue, they talk about three pillars of public health. The first is public health is based on science. The second pillar is public health is focused on prevention. We're less focused on how to treat victims of violence than how to prevent it. And the third pillar is that public health is collaborative at heart. It's not just working with medicine and doctors, but it works with criminal justice and law enforcement, schools, education, architecture, urban development. So public health is based on science, focused on prevention, and collaborative at heart. What does it mean to say it's based on science? Most people don't understand that. And it's not rocket science, but it means that we ask and answer four simple questions. The first question is, what's the problem? And we ask the questions here that any good reporter would ask: who, what, where, when, how? Who gets shot, where, under what circumstances, how, with what sort of weapons, where do the weapons come from, and what's the relationship of the shooter to the victim? And are these increasing or decreasing? But that's what's the problem. The second question we rely on science for is, what are the causes? What increases the chance that someone will shoot someone else or that someone will become a victim? What's the role of mental illness? What's the role of drugs and alcohol? What's the role of domestic violence? What's the role of terrorism or hate crimes? That's the second question. What are the causes? The third question is, what works? What works to prevent these shootings? And here it's important to say, you've got to test it. If you have an idea that arming citizens and letting more people carry concealed weapons is going to prevent more shootings, you have to test it out and you have to try it. If you think that arming every teacher at every school is going to save more lives, you have to try it out and you have to test it. Science is so important here. And the last question is, how do you do it? Once you find things that work, when I say work, they have to work both to reduce gun violence and to protect the rights of law-abiding gun owners. When you find things that work and you've demonstrated that they work, how do you put them into policy, into legislation? How do you scale them up and spread them? So this is what we mean by saying science has an important role here. And science is the pillar of public health.
And Mark, in medical clinical trials, sometimes when you split a clinical trial into a couple of groups, and one group, for example, is given a placebo, and it's determined that actually those who are receiving the medication are doing so much better than those on the placebo that it would actually be unethical to continue the placebo group on a placebo. Sometimes clinical trials are abandoned because it's considered so damaging to the one of the particular groups to continue them on that trial path. How would that apply to, for example, trying arming everybody or arming every teacher or whatever? How far could we go? Would we have to apply that same sort of standard of, hey, we want to test it out to have empirical data, but at the same time, at a certain point, we have to be able to say, hey, you know what, this is a disaster. Would that same sort of logic apply to the tests you're discussing?
That's a really, really good question and a good thought. But in the area of gun violence prevention, it's much less a question of when to stop a trial than how do we get the trial started. Basically have stopped all the research on this critical issue of what works. We just don't know. And it's more like a trial that was insisted upon. In the 1970s, there was a drug that was supposed to be a miracle drug. It was solved the problems of pregnant women. Pregnant women suffer from two things. One is nausea or morning sickness, and the other is insomnia. They can't sleep. And the drug company came up with a medicine that treated both the insomnia and the nausea. And they went and they started marketing this in Germany. And the German people felt this was such a miracle, they could sell it over the counter. And they sold tens of thousands, hundreds of thousands of pills. They tried to sell it in the United States, but a very brave woman doctor, Dr. Kelsey, worked for the FDA, and she said, before you can sell it here, you have to demonstrate two things, that it's safe and that it's effective. And the drug company said, no way. Come on, common sense. Look at how many are being sold in Germany. Look, it solves the big problems of pregnant women. Don't make us do the trials. And she said, you've got to do the trials. They went back to her and the FDA 7 times, insisting to let her sell it. And 7 times she said, you have to do the trials. You have to show us it's safe and effective. Well, in Germany, it turned out that this caused an epidemic of people to be born without arms or legs, and many other fetuses to be aborted and to die in utero. The drug was thalidomide. And it was this brave person who stopped us from this epidemic here by saying, no, you have to show it's safe and effective. Right now, we're asking legislators to pass legislation like arming all citizens with concealed weapons, or arming all teachers, or allowing the sale of semi-automatic rifles to anyone who wants to buy them. We're asking legislators to pass legislation where they don't know if it's safe and effective. This is the job of science. It's not fair for us to put them in that position of asking them to approve thalidomide without the data behind it. We've got to get this started. It is really critical. It's a matter of life or death.
Mark Rosenberg, founding director of CDC's National Center for Injury Prevention and Control and a retired assistant surgeon general. Thanks so much for talking to us about this.
Thanks for raising this important issue to your listeners. This is really important. Thanks.